So let's come to our first case. Here we talk about a female patient who was 2 years old at the when the patient was diagnosed, and the patient was coming from a non-consanguineous family, and the parents were asymptomatic, and there were no affected siblings. The main phenotypes of this patient was short stature, some facial abnormalities, a myopathy, and skeletal dysplasia. Because of this phenotype, we first carried out the NGS panel diagnostic for Duchenne and Becker muscular dystrophy, and also excluded SMN1 and SMN2. And then we carried out a trio exome because these analyses were negative. So when we started our case, we first used those filter buttons. Here in this case, it's so-called patho-improved filter button, which is was customized by us. So it will show us all those variants which are either pathogenic in ClinVar or in our own database or in the varvis database. And as you can see, we found 2 variants in the selenon gene, and those 2 were described in ClinVar already and were also not homozygous in the GNOMAD database. And then we obviously looked at the genotype-phenotype correlation, and we found that in the gene and compared to the patient, we had 3 HBO matches shown here, and we had a SIM score of 0.21, which is like moderate match. And you can see here, this is also shown by the software, that there was a HBO match shown here, because both for the gene and the patient, there was myopathy described, and also short stature, and also congenital muscular dystrophy. But you can also see that, for example, the knee contracture and the knee flexion contracture were not the exact match, but it's obvious that those 2 terms are very similar, so therefore you got a high SIM score, and the same was true for the muscular dystrophy, which also the muscular dystrophy here and the congenital muscular dystrophy, which is also quite similar. And since this was a recessive, there's a recessive inheritance described for this gene. Obviously, wanted to know if those 2 variants were actually in trans constellation. Therefore, we used a compound heterozygosity filter provided by varvis, and this will show you, and for a solo exome, if there's more than 1 heterozygous variant in 1 gene, and for a trio exome, more than 1 heterozygous variant in the index, and of course, it should be one of them should be maternally, and the other one should be paternally inherited. So we turn on this compound heterozygosity filter, and you can see here very nicely that both the mother and the father were carrying this variant heterozygously, and therefore this was a nice explanation, was a nice finding. And now we come to my first question. So would this finding explain the patient's entire phenotype? Well, obviously no, otherwise why would you ask? Or yes, certainly it's a trick question. Okay, I guess we have 1 voter. Oh, there's more. Okay, so it's pretty mixed, as you can see. So we decided that it's not actually covering the whole phenotypes because, for example, the facial abnormalities were and the skinny dysplasia was not really matching, and this also fits to the moderately high HbO SIM score. And this you can also see when you look at the phenotype. Some of the symptoms are matching, while others don't really match. So we got a nice finding, which explains at least partially the phenotype of the patient. And so to come to a short summary of this case, take-home message. So by using the inheritance filter by varvis, we can nicely filter for example, for compound heterozygous variants, and we use these a lot for the exome analysis. And the HbO similarity score can be used to filter for variants according to the genotype-phenotype correlation.